Testosterone replacement therapy, TRT side effects, is it safe and is it for you? If you are hypogonadal and you receive testosterone replacement therapy, you can expect on average to see some results. Who is hypogonadal? Hypogonadal are those who underproduce testosterone for a variety of reasons. In the United States, we use the reference range of 300 to 1000 nanogram per deciliter of testosterone in the blood. And you are considered hypogonadal if you are below 300 nanograms per deciliter. TRT effects. If you are originally hypogonadal below 300 and receive TRT, a lot of times you get improved sexual function, your mood and sleep and sense of well-being tend to become elevated, your energy and cognitive performance improve, and so do other health markers. And yes, you can gain and maintain a larger amount of muscle mass and less body fat if you are hypogonadal to begin with. Eugonadal individuals. Now, for those who produce a normal amount of testosterone, somewhere in that 300 to 1000 range, if they start taking testosterone, usually nothing noteworthy happens because they are trying to replace something that was there anyway. Unless, let's say, you're at 350 and boost it to 900. But what is the compelling reason for doing that? If you're producing a normal range naturally and then you take an injection, that suppresses the normal production to 0. And now you're at the same amount except through injection. Natural reinjection, same testosterone levels, and the same results, roughly speaking. And if your body was doing just fine and producing 400 nanograms per deciliter and now you're at 1200 or something over 1000 or close to it, that's not a replacement. That's enhancement. You just multiplied your testosterone exposure by 3. So some of those effects are going to be positive and some are almost certainly going to be negative. All TRT seeks to accomplish is to get you back up to normal levels so that you're functioning optimally from a perspective of health, physically, psychologically, sexually, etc. It is not designed to get you ripped and jacked. And in most cases, it simply won't do that because it's a replacement therapy, not enhancement therapy. Here is the downside. These are some of the things that you should really think about in advance. Some of these are the actual reasons that I changed my mind about TRT. Number 1, your natural production can plummet to 0 after several weeks of the exposure to TRT at most, unless you take HCG and maybe a few other drugs along with that. Oftentimes, your testicles shrink to very close to nothing, and if you ever want to come off of TRT, then your rebound can be difficult. You could be low in testosterone for month and month and month until you come back out to normal. And some people never get their natural production back. It's a very small number of people, but it does exist. So it's just a major serious risk. Again, you better know what you're signing up for before you commit to it. Number 2, you have to shoot yourself either daily or weekly or bi-weekly with various sizes of needles for a long time. It's a change in your lifestyle. It's a drug. Once you get on it, you have to stay on it. Traveling, especially traveling internationally, will be very difficult. You have to travel with your gear because if you go on a vacation for 2 weeks, you need your gear with you. Otherwise, you're hypogonadal by the end of those 2 weeks and you will feel terrible. Number 3, everyone is different, but in reality, you're injecting hormones and your body and your immune system could show a lot of uncomfortable, serious reactions to it, including hair loss. The number 4 downside is your mood can swing up and down with injections and throughout the week. The reality of TRT is not as bright and pretty as it is perceived, so you have to have a compelling reason to need TRT. Here are 3 hypothetical scenarios. Hypogonadal and no symptoms. If you are hypogonadal on paper, that means you are tested below 300 nanograms per deciliter, but you don't really have any problems. Like compared to your average guy friends, you're normal. Your sex drive is normal, your muscle mass is normal, your motivation and everything is normal, you're good and golden. You probably just have high androgen sensitivity. So you might want to stay natural and away from TRT and from all the risks and negative side effects that come with TRT. TRT is not something that you just do. Normal range, no symptoms. If you're somewhere in that normal range, even if you're just above the 300 cutoff and just don't have any symptoms of low T, stay away from TRT, especially if you're young, and definitely talk to your doctor about it. Hypogonadal and have symptoms. If you have done your blood work and you are hypogonadal on paper and you have multiple symptoms of being hypogonadal, then you might want to give TRT a little bit more thought and have extensive talks with your doctor about it and certainly get a second opinion. That's what I would do. And in the meantime, make sure you're doing all the things that can naturally boost your testosterone levels, because doing those natural things might just give you the result that you want and save you from being on hormones for a long time, all the side effects, expenses, and difficulties that come with it. If your body truly does not need TRT, the cost of doing TRT can be very high and the benefits are on average not considerable. You're just the same, but now you need the needle to keep you the same. Talk to your doctor, get your blood work done. Do not rush into TRT because TRT is for the vast minority of the people that truly need it and can benefit from it. If you'd like to know how you can naturally boost your testosterone levels, I highly encourage you to watch this video. And if you found this video helpful, please show your support by simply subscribing to this channel. Thanks for watching. See you next week.